Okay, so I want to get started today. I want to welcome everyone to the Network Commons. This is a Build Healthy Places Network live discussion series on cross-sector strategies to improve neighborhood and well-being. My name is Doug Judy, and I'm Executive Director of the Build Healthy Places Network, as well as a pediatrician and professor of public health at the University of California, Berkeley. And I have the honor of serving as moderator for today's discussion. So today we're going to be discussing early childhood and specifically how the neighborhood level investments and work of the community development sector can help support the health of children and their families. We're lucky to have three national leaders joining us who represent a wide range of sectors involved in this work, including community development finance, philanthropy, and child development research and policy. You can read details on the full backgrounds of our speakers by clicking on the links that we'll provide you in your chat box, but I also want to provide brief introductions. So first I'd like to welcome Nancy Andrews. Nancy is President and CEO of the Low Income Investment Fund, or LIF, headquartered here in San Francisco. LIF is a national nonprofit community development financial institution, or CDFI as it's known in the industry, dedicated to creating pathways of opportunity and health for low-income communities and people. Nancy has worked extensively in the community development sector for over 30 years, and as CEO has played a central role in LIF's increasing focus on health and early child development. And to give you a sense of scale, LIF has directly invested nearly $2 billion into low-income communities, reaching nearly 2 million people. And those investments have catalyzed almost $9 billion in total investments. And looking just at investments in early childhood, LIF has put $114 million into childcare facilities and nearly $500 million into education. And I want to say that again, just because many of us on the call here may not fully understand this industry. $500 million LIF has helped direct into education. Combined, this work has resulted in 256,000 new childcare slots and 75,000 new spaces in schools for low-income children. I say all that to give you a sense of the scale of and the impact that this industry is capable of. And it's worth remembering that LIF is just one of several national CDFIs. Next, I'd like to introduce Dr. Jim Marks. Trained as a pediatrician, Jim is now Executive Vice President of the Robert Wood Johnson Foundation, the nation's largest domestic health and healthcare foundation. There he oversees all programs, communications research, and policy activities in support of the foundation's vision to build a national culture of health. Dr. Marks has been a national leader in public health, maternal and child health, and chronic disease prevention for more than 35 years. And among his many titles, his most prominent have included Assistant Surgeon General and Director of the National Center for Chronic Disease Prevention and Health Promotion at the Centers for Disease Control. And finally, I'd like to introduce yet another pediatrician. We've got you surrounded today, Nancy. Dr. Jack Shonkoff. Jack is a Harvard professor and founding director of Harvard's Center on the Developing Child. Importantly, in the year 2000, Jack led a National Academy of Sciences committee that produced a landmark report, From Neurons to Neighborhoods, the Science of Early Childhood Development. So that means that over 15 years ago, Jack was already talking about the role of neighborhoods in child health. So I'm delighted that he's come full circle and is joining us today to discuss the potential role for the community development sector to protect and enhance the health and well-being of children and families in our most vulnerable neighborhoods. So from a personal perspective, I just want to say that these three speakers today have played a really important role for me in my transition from being a traditionally trained pediatrician practicing in the low-income community to my current work with the network, where we really focus on catalyzing and supporting greater collaboration across these sectors of health and community development. I had the good fortune of meeting Dr. Marks almost 15 years ago when he sat next to me at the first dinner of the Robert Wood Johnson Health and Society Scholars Fellowship Program that I had the opportunity to join. The individuals that I met in that program really changed the trajectory of my work. And I want to add, actually, that the foundation is just now, 2 weeks ago, the announcement came out for the launch of several new fellowship programs focusing on creating leaders for a national culture of health. These programs are designed for both academic and non-academic practitioners, so I encourage everyone listening to take a look. The Build Healthy Places Network is a partner in this effort, so we have an announcement on our homepage that you can find there with more details, and we'll post a link in the chat box so you can get to it directly. Another important frame of reference for today's discussion, I had the opportunity to meet Jack Shonkoff, who'd been a hero for many years already, in 2009. That year, Dr. Lisa Chamberlain and I from Stanford helped start a series of plenary panels at one of the national pediatric conferences, and Jack agreed to speak on it. We were focusing on what was a relatively new idea at the time, the social determinants of health. So it's important to remember, it's worth highlighting that only 7 years ago, pediatricians in the medical field in general were only really initially coming around to this idea. And yet now, in 2016, the role for social determinants and the importance of place in health is really considered mainstream. That same year, in 2009, I met Nancy Andrews, when she wrote a very forward-thinking article for the San Francisco Federal Reserve titled Coming Out as a Human Capitalist. We'll provide a link to her article in the chat box. In that paper, she described what she saw as the connections between the community development work she was doing and the health and well-being of children and families in low-income neighborhoods. That paper helped launch a series of conferences, now more than 24 across the country, sponsored by the Federal Reserve and the Robert Wood Johnson Foundation, trying to link community development and health. Hopefully some of you listening today actually were able to participate in one of those. And that work really led to the development of the Build Healthy Places Network where I sit now. So I couldn't be more pleased to have Nancy, Jim, and Jack together here today to lead our conversation on the links between this field of community development and early childhood. So today I'm going to kick off the conversation with a couple questions for our speakers, but then we'll move right into questions from our audience. Incredibly, we received 60 or more questions from our audience as you were registering. So we're going to do our best to get to as many as we can and try to consolidate some of them. If you want to, you can continue to ask additional questions in the chat box or through Twitter that we'll be following using the hashtag #NetworkCommons, all one word. So I want to thank all of you who already submitted questions prior to the event, and we'll see what we can do. So with that, I'd like to open today's discussion by first asking our speakers to share their thoughts on why neighborhood environments are so critical to supporting children's health. Jack, I'd like to start with you. Based on your many years of research on this topic, what does the neuroscience tell us about the connections between children and their social and physical environments?
Great question, Doug, and thanks, just to start, thanks for giving me an opportunity to be part of this event. So, you know, what neuroscience is telling us, and neuroscience, kind of referred to as is really reinforcing what child development research has told us for decades, but now we're understanding it right down literally to the molecular level, that the environment of relationships in which children are raised, beginning from birth, literally shapes the architecture of the developing brains. And the key active ingredient in that environment of relationships is...
Jack, can you speak up just a little bit?
Sure. You know, the key element of the relationship environment is the extent to which adults are responsive to children. It's kind of back and forth, serve and return interaction. And the extent to which that is occurring in a safe, stable, predictable kind of environment, that creates a sense of regularity for children that literally strengthens their brain circuits. And what happens between children and adults doesn't just happen in isolation. It happens in a context, in a community. It's not just the parents who influence children's development. It's the other adults in their lives, extended family, neighbors, and also people who provide care in child care centers, for example. So the reason why the neighborhood context of the community is so important is that it either provides an environment that supports kind of healthy family function, or it provides an environment that undermines the ability of parents to provide a safe and responsive environment for their children. And that context affects adult behavior, which then affects the environment in which the interactions take place, and that literally affects the development of the brain and all of the other organ systems in the body. So that's why this context is so important. We've understood it conceptually for decades, but now we're actually understanding how it works at a biological level.
Great. I appreciate that. Thank you, Jack. Jim, one of the Robert Wood Johnson Foundation's core pillars is supporting child and family well-being. So from your experience as a public health practitioner, now as a funder, why is early childhood such a critical piece, play such a critical role in building a culture of health?
Thanks, Doug. And I want to also express what an honor it is for me to be sharing this dais with the other speakers. I guess the way that we think of it, as we think of what the nation needs, it is this fundamental um, understanding and shared sense of how important health and well-being is, both for our nation and for our children. That's why we think of it as a culture of health. That is, it's an overarching way we try to improve our society. Children and families are at the center of a culture, a center for any change in culture. And so children are really crucial in the focus that families and society make. The other part of it is, in fact, if we can raise our children and keep them healthy and educate them well, it's easier and more effective in the long term. Jack has already touched on an important element also. The science is much better than it used to be. The science about the importance of vulnerability and their long-term effects, or the science about adverse childhood experiences, about poverty. There was even a popular online magazine that had the headline, "Poverty Goes Straight to the Brain." That kind of understanding it is helps us see how what our social policies, our social practices are, and how they affect biology. The other part of it is as we've learned that, our ability to intervene, to mitigate the effects of difficult early childhood, or the effects, or to create the positive ones, has gotten stronger. Our information on the importance of good quality child care, of school, of helping children learn how to interact with each other, whether it's in sharing and helping each other. All that science is coming together to say we can make a difference for improving children and where they and how they develop and how they help shape our society. So we see it as natural to bring the investments in children with the goal of improving a culture so that it makes health and well-being a centerpiece of what we do. And of course, as Jack implied, and as the science is getting strong, it is really clear how important the effects of the earliest years and even months of life are for our children.
Yeah, thank you. And Nancy, how about you? So based on your work at LIF, how does the community development sector typically see its role, or how do you see its role in supporting early child development? And I wonder if it makes sense, you might mention the event you just came from this morning, working with the Ford Foundation and Darren Walker, if that is relevant.
Sure. Well, I'll start by saying that those of us who have been in community development for decades and decades of our lives always thought of ourselves as agents of economic change, economic growth within neighborhoods that had been distressed. But thanks to the visionary work that we've seen in Jack Shonkoff's book, From Neurons to Neighborhoods, the leadership that we've seen with Robert Wood Johnson, with some of the other knowledge that's been emerging over the last decade, we've woken up to the fact that we can really work as hard as possible improving the bricks and mortar of a neighborhood, but if we don't also think about the human capital, think about the young children in particular that live in that neighborhood, we're really missing the centerpiece of the agenda. And so we have come to think about investing in young children as being one of the primary, if not the primary, component of effective community investing work. Years and years ago, when the Low Income Investment Fund began working in the city of San Francisco to invest in child care centers and early learning programs, we did that actually thinking that what we were doing was related to a workforce development strategy. We really thought that this was a way that would enable moms and dads to be successful in the labor force. And it didn't take too long as we began to understand the work of Nobel scholars like Jim Heckman and many others, that we saw actually that's the least important part of the equation. We can't make neighborhoods better if we can't also make the people that live in the neighborhoods, especially the young people, better. And so those of us who are engaged in community development and been doing this work for decades now have really begun to see that there is a sort of a brilliant marriage, if you will, between the work that we have traditionally done, but the outcomes that we want to see in the lives of young people that live in the neighborhoods where we're working.
No, that's really beautifully put, Nancy. And I think all of us here experience this sort of reframing of our own work. Nancy, you in particular, I think, as we've talked, your work was already in health, but it wasn't the way in which the background you come from or the way you saw it. And I think Jack and Jim, we were working in trying to understand how neighborhoods played a role in child health, but not fully understanding that there were colleagues like you who actually changed the fabric of neighborhoods. I want to actually point out in the chat box, I was going to mention it myself, but I was beat to the punch. On our site, and with a link in the chat box, David Erickson and I wrote an article that was published in Pediatrics that sort of summarizes a lot of these ideas. And David put the link in, and we'll double check and make sure that that's the right one to get it for free. It's also on our website. I also want to point out on our website, to summarize a lot of what we just heard, Paula Braveman, who's a professor at UCSF, wrote a report with us about making the case for linking these two fields, or these two general sectors, and that is on our site as well, along with an interview with Katie Ware, who's at the Robert Wood Johnson Foundation, who's asked specifically about the Foundation's interest in connecting these sectors. So I'd like to make sure our readers, our viewers have ample opportunity to dig deeper once we're done here today. So as a second question before we get to the audience, given the strong medical evidence on the connections that we now have between early child development, neighborhoods, and health, what is the way forward? How can community development and cross-sector collaboration support children's health? So Jim, I want to come back to you. How does the Robert Wood Johnson Foundation view the role of community development in building healthy communities for children and families?
Thanks, Doug. One of the things that's been very nice for us, and I don't want to say surprising, but it has been helpful, is when we had the commission to build a healthier America, that commission recommended that we look to help transform how communities are developed to help help. That, plus the work that you and David and Nancy have done, have really energized us. I remember well a conversation I had with Nancy as we were at one of the conferences that the Federal Reserve was putting on, asking her, getting a sense of why this was so valuable for the community development field. And Nancy and when it came to the notion, this was almost like a large family reunion, where there is a cousin you've heard about but never really met. And when you get to that reunion, not only do you meet, but you find you hit it off really well. They were trying to make not just the communities, but the lives of the people in those communities better, that they could improve their overall well-being, even as she described their investments in child care. And frankly, for us, we realized that we had too narrow a focus on health care and not enough on health and well-being. So neighborhoods are a central place. Where there's issues of safety and security are crucial to families. The connections between people, neighbors, and others. The importance of jobs and schools and food and housing and parks. All of that is crucial to being a good place to raise a family. The other is, as we started to look at the differences in life expectancy by areas of major cities, we found that the differences in life expectancy were huge. So like in New Orleans, it could be 25 years of life difference between places that were 10 to 15 miles apart. And you could find other differences like that in any major urban area. So that got us to the issue of the importance of zip code as maybe being more important to one's health than genetic code. And David very quickly recognized that community development was in the zip code improving business, and we actually have a shared purpose. So this has been, for us, an incredibly valuable connection. I haven't even talked about the specifics of housing relative to asthma, relative to safety. When you lower the price of housing, you make resources available for low-income families, for better food, for be able to purchase health care and or medicine, or help their kids go to school. All of those things help a family and a child succeed. That's why we see this as a central partnership.
That's great. Yeah, and it's David Erickson who said community development's in the zip code improvement business. He's good with the one-liners, I've discovered. Nancy, so can you tell us a little bit more, give a little more detail about some of LIFT's investments in early childhood and child care centers, and any outcomes you know, and sort of what your frame of reference was to it sort of focusing on?
Sure, Doug. The last half of your question dropped out for me, so I'll answer what I think you were asking, and if I veer off in the wrong direction, please pull me back in. Okay. So we provide investments in the physical environment of child care centers. We help them improve in their quality, and we absolutely know that that has very positive health impacts. Now, I'll tell a story about that, and this is a story that's told on a short video that the Robert Wood Johnson Foundation funded. There was in Oakland, there was a child care center called Booth Memorial. We provided a very small $60,000 investment to help that child care center to pull up an old rug that had been in the center for about 20 years, to improve the windows, to add healthy play space, to bring in healthy food gardens for the young kids. And something very surprising happened. We weren't expecting this. We suddenly discovered that the attendance rate at the child care center went up from about 60% on average to about 90%. And we said to ourselves, why on earth did that happen? And the answer was the kids had a much healthier environment, and as a consequence, they were not having the severity or the frequency of asthma attacks. So they were no longer in emergency rooms. Now, we also learned, part of what we did with this investment was we helped the child care center install toddler-level sinks. So suddenly the workers, the teachers in the center, didn't have to lift the children up and physically hold them over an adult-level sink. And we discovered that the disability claims among the staff plummeted. And suddenly we found that kids were healthier, the center staff were healthier as well. The center was better financially because it wasn't having to pay for disability claims, and it also had a higher attendance rate. So the financial stability of the center improved dramatically, and the health outcomes of everyone also dramatically improved. And the light bulb went off in our heads because we had been learning about how important asthma is among low-income populations, particularly among young people. And we said, we thought that what we were doing was investing in early learning, but it turns out we actually made a health investment in addition to early learning. And we realized we were in the health business. And so we began to look for it and discovered that examples just like the one that I gave are happening in almost every child care center that we're involved in. So this was really, in many ways, a life-changing moment for us at the Low Income Investment Fund, and it helped us understand just how many spin-off benefits, the sometimes very tiny investments that we have in the physical in the quality of the physical environment can be to young kids and also to their families.
Yeah, and I'll point out that my staff put the link, Nancy, to that video where you talk about the Booth Child Development Center in the chat box. And remind me, the term that you used for that loan to them, was it a repayable grant? Is that the language?
It was actually well, yes, it was actually a repayable grant, and we've tried to replicate. We do those kinds of grants over and over. This particular one, the Child Care Center used as a seed grant, and they began going around to other foundations and other partners and using it as a basis for leverage. So they ended up taking a very small seed grant from us and tripling its size by getting others to chip in as well. And so by the end of the day, they had raised over $100,000 just starting out of that one little grant. They raised about $100,000 to improve the physical environment of their center.
Yeah, and I think for this audience, one of the things that struck me that I really found fascinating was this idea of a repayable grant is a zero interest loan. So you got that money paid back and then were able to lend it out to new child care centers. Is that right?
We often will do that. In that particular case, that was actually a grant, and it stayed with the center as long as they were successful. But in many cases, we actually do make recoverable grants or loans, and they come back. They all get paid back. I think we've had in 20 years, we've had maybe one that didn't repay. So I think this is a very important point, Doug, that you're making, that this can be done in a way where we can actually recycle capital and deploy it over and over and over again, so the value of it is multiplied many times over.
Yeah, it's a very different approach, and that idea that you said of leverage, it encouraged others to invest as well because you had made that initial investment. Jack, so I just want to get your perspective. When you learned about this kind of work and met Nancy, what do you find compelling from your perspective about the community development sector as it relates to early childhood, and how do some of these efforts inspire your work?
Yeah, no, I'm loving this conversation, and I'll tell you what I find compelling and what's inspiring me on this. What's compelling is this kind of increased attention in a very serious way to not just talking about the importance of community, but really trying to kind of engage in some significant action on the ground, and to look carefully at what are we accomplishing, what are the goals, and to try to make the links more explicit between community activities, community-focused investments, and actually how this translates into health. So the one thing that I find compelling is that there's more attention to this, there's more discussion, but not so much discussion just for its own sake, but discussion among people who are in a position to actually make some serious investments and to try to move this agenda. But I'll tell you what I find inspiring, and it's this is the other side of the story, because the importance of community context, the importance of doing something about poverty, housing, access to good nutrition, employment opportunities, all of the things we've talked about are not new ideas. A lot of these things were part of the Brain Trust that put together the War on Poverty and the Great Society programs. Head Start, community action programs were an important part. Neighborhood health centers were an important part of that era. So on the one hand, we've talked about this for a while, but we have a capacity to really get serious about this now that we've never had before. And I think there are two reasons for it. One is because of the leadership of people like Nancy and Jim and others who are really out there trying things and making significant investments. What I find inspiring about this right now, to be really blunt about it, is the people who are at the cutting edge, one of the most creative things, who are saying, we want to understand better what we're doing, and we want to understand better why these kinds of investments actually translate into health outcomes. And this is where I think this kind of revolution in biology that we're living through right now, in neuroscience and molecular biology and epigenetics, is offering a tremendous opportunity to ratchet up our thinking about this. From my own perspective, until a couple of years ago, most of the uses of the science by people in this field was to make the case for why investing in these areas is important. And I think we're poised now to kind of take this to another level, not to use this greater scientific understanding to make the case for doing the best of what we've been doing, which is obviously where most of our energy should go. But we also have an opportunity to use the science to ask, where should we be going next? Where are the new ideas? How do we use the science to fill in, connect the dots and fill in the explanation for what is it about housing, what is it about community development from a kind of on-the-ground perspective? How does that translate into better health over the long haul? And that kind of thinking should be stimulating some new ideas, new theories of change, new hypotheses that could then be put into programs that we test. And this is, for me, the most compelling and the most inspiring. The other folks in the community development world, and Jim's putting that into a healthcare context, and the work that you're doing, Doug, through Build Healthy Places Network, is basically saying, what could we do differently? Because at a population level, we're making pitifully small progress in reducing a lot of these disparities by income and by race and ethnicity. So I'm excited by that part of the community development world that is saying, I want to connect with people in the early childhood world. I want to connect with people who are studying brain development and figure out together what we could do differently. What could we try in communities that are already doing the best of what we know and want to take things to the next level? To me, that's the inspiring part. It's the missing niche in all of these fields. It's the R&D platform, right? It's the part of the field that is kind of above and beyond best practices. It's saying, where are we going to be in 10 years? Where are we going to be in 20 years? Where are the new ideas going to come from? That's my juice is going on this, kind of all these new opportunities between pediatrics, human services, community development, education, healthcare system. You can add anything else you want to the list. We need to develop some new ideas and test them, and to give it some space to try and fail and learn from failure.
That's great. Yeah, and I'd encourage our viewers to go to Jack's website at the Center for the Developing Child and check out Frontiers of Innovation. FOI, Frontiers of Innovation, is his work to really speed up learning in this area. I'd also suggest, and I'll have our team put these in the chat box as well, but Jack brought up the issues of measurement. And so we have a portal on the Build Healthy Places site called Measure Up. And one particular tool that I think might be of interest to this audience specifically is called the Child Opportunity Index. We'll put the link up there. And it allows you to map opportunity across neighborhoods as well as layering race ethnicity on top of it. And the last thing I wanted to mention just quickly here, sort of to Nancy's point and the holistic approach to neighborhoods, we've got a series of case studies called Community Close-Ups on our site. And a couple of them in particular are using what's called the purpose-built communities model, looking at East Lake and also down in New Orleans. So those case studies really are focused, a couple of them are focused very much on early childhood, and I think will give a richer sense of the type of work. So I appreciate all of your answers to those questions, and we're going to now turn to Rini here has questions for me to share. So I'm just going to read the first one here. Hey, Jim, this one's for you. Jim, how should community builders make the case for early childhood investments in low-income communities amidst other urgent challenges such as unemployment, crime, inadequate food access, and unstable housing? How do we convince policymakers and health departments that early childhood is the right place to invest?
That's a core question for all of us. I think that, first of all, I want to make sure people recognize that whether it's investments in safety or in housing or employment, those are also investments in families and their children. So these are linked, and we have to. And if there's anything that's come out of this increasing interest in social factors and their links to health, it is how linked things are. Now, let's come back to why you would invest in children. I think that we're increasingly seeing the business community and civic leadership recognize that if they aren't a good place to raise a family, they will not only not attract families, families will move away. If they aren't a good place for education for children, the children that do well will move away. And so that for their long-term success as a community, as a business community, they've got to be a good place for children. I was really struck in these discussions here. Doug, even in your intro, you mentioned that Nancy's organization had taken $2 billion worth of investment and leveraged $9 billion worth of additional resources, 4.5-fold ratio. Really terrific. What we're also seeing here in children is investments in early childhood pays off the best. That's what the research from Jim Heckman, the Nobel Prize-winning economist, tells us. And it is not just investment in their health, it is investment in their education. And they link together. The children that are the healthiest will do better in school, and the children that do better in school will live longer. In fact, the evidence suggests that for every additional year of school, people live a year longer. So these are linked. And so if you want the best leverage, you invest in young children in both health and education and the community in which they live.
Mm-hmm. That's great. And actually, on that point, Jim, I might ask my staff to see if they can pull this link up and post it. On Jack's website is a short video focusing on the two-generation solution. So it's focusing both on the children, but as you were suggesting, on their families, on their parents. We need to help the whole family at once to really have the impact we want to have. And so I think that was a really eye-opening and useful visual for me. So Nancy, you've got the next question. What gets in the way of early childhood education being included in community development projects? What do you see as some of the potential solutions to these barriers that you've come across?
Sure. So I think there's a fairly straightforward answer to that question. If you rewind 20 years ago, part of the answer was that those of us in community development were not 100% clear how a human service like child development really was connected to our agenda. But I think we've crossed that bridge, and there's been a conversion in the past 5 years where there's a wide recognition now that this is very, very central to the work that we do. But unlike the other sectors where we make sizable investments, affordable housing, schools, health clinics, the child development sector has not received a sufficient degree of support from the public sector to make it possible to do the kind of investing that we think needs to be done. So just to give you an example, in the housing field, there's an entire industry that has matured over many years, and a wide range of federal programs that exist that support and encourage building for low-income people, building affordable housing for low-income people. There isn't the same income stream that's available for early learning and child development programs. If there were, we are ready, willing, and able, I think, to leverage that as efficiently as we possibly can, and we are absolutely true believers in how important it is. But I think this gets to something Jim was just saying. We need to create, there needs to be a stronger public dialogue and discussion about how to invest in this area, the right way to do it, who the partners are that need to be there, how to create a union, if you will, between capital markets and private investors, along with public and nonprofit organizations like my own. But we need to address that larger policy environment question and there's a lot of work ahead of us to get it right.
Yeah, thank you, Nancy. I've got a pair of questions here. I'll sort of summarize them. They come from Nicole DePass at Harvard Medical School, a medical student there, and Joan Young, also a fellow at Harvard Medical School. Apparently, Jack, you got the word out there. So how can pediatricians, primary care providers, and other healthcare providers become involved in supporting healthy neighborhood environments? And this really is for Jack, you and Jim. Are there examples of productive partnerships between the medical providers, early childhood education providers, and urban planners, et cetera? Have you seen role models for that?
Sure. You want me to start, or do you want to start, Jim?
Why don't you start, Jack?
Okay. So I guess I'm going to continue the theme that I brought up before to just maybe play this role here. So I think there's no question that if we look at the history of engagement of pediatric practice with a variety of other actors in a community setting, there are lots of examples of the best that we've ever done, and lots of examples of best practice. And the elements of that are no surprise. It's people who get to know each other, who easily interact across sectors, who share information with appropriate safeguards for privacy, and who are very focused on doing well for the children and families they serve on an individual basis. I think, and because the policy and the funding environment is so oriented towards saying, tell me what's successful and I'll invest in it, is that we've built up over the years disincentives for people to talk about why things aren't working when they're not working. And I think, to me, this is one of the big issues that has to be put out on the table, because we have a different consciousness about this right now. We understand, I mean, we've been talking about this for the last half hour. We understand the connection, we understand the importance of a community perspective and its relationship to health. But what's missing on the table is decades and decades of experiences. We haven't asked and answered the question of, so why has it been so hard for so many pediatric practices to connect the community agencies? What have we learned from housing and economic development initiatives that haven't worked, so we don't make those mistakes over and over again? So for me, the connection, the best practices, the best examples of pediatrics connecting to communities is really mostly in the realm of people truly being committed to working together, and then there's the big elephant in the room who pays for that, right? The big cry from the people in pediatrics is nobody's paying for that time, and it's hard to make it done. But I want to go back and connect this to the zip code and the genetic code issue, because the other thing the science is telling us is that there's huge variability among children and families in terms of their resilience and their vulnerability. And whenever we focus exclusively on what's the best example of what works, we're missing the important questions under that, which are what worked for what kinds of kids and families and what worked for other kinds of kids and families. Because if you're dealing with poverty, for example, there's a big difference between a pediatric practice dealing with a family raising children in poverty with or without serious depression, with or without substance abuse, with or without serious violence in the family, with or without very limited education and the poor likelihood of getting a well-paying job. And so I think that kind of differentiated response is really what has to be built into the healthcare system. You know, we all understand it now when we talk about precision medicine, right? So we have to kind of figure out how to adapt this concept of precision medicine to the problems we've been talking about right now, because there will not be one example of how pediatrics is dealing well with poverty. And this is where I think pediatrics has a huge leadership role to play by bringing the science. This is where the pediatricians kind of have credibility. So we used to say in the 20th century, the old nature versus nurture debate. Well, if it's genetics, there's nothing we can do about it. If it's the environment, we'll fix it. So now it might be that 21st century medicine says we can change the genetics, we can change gene expression. It might be much harder to change the environment. I think if we start to kind of bring this scientific thinking in and try to adapt a more differentiated response of different kinds of ways to bridge these gaps to deal with different kinds of challenges that families are facing, will be much better off than asking for just what is the one best example of how pediatrics and community development can improve health outcomes. It's like asking what's the best treatment for cancer, or what's the best treatment for an infection. It's like, well, it depends. What kind of problem we're talking about? What are the arrays of treatments? How do we match the best? So I'll just kind of put that out on the table for some.
So, Doug, I'm going to amplify on this just a little bit, and maybe take some of Jack's comments and highlight what they mean. Research is what turns something from bad luck or fate or misfortune into something that can be changed. But it turns that understanding over to society. And there it's the policies and practices that a society adopts, its culture really, that change the likelihood of disease or injury or school success. Pediatricians, other health professionals have increasingly been active, but only recently have we had enough science to say they need to be active at a higher level. So it was pediatricians that argued for laws at school entry for children to be vaccinated, knowing that that would cut down the spread of vaccine-preventable diseases. It was the pediatric, the maternal and child health community that argued that women who were low income and eligible for WIC benefits who wanted to breastfeed would get support. Before it was only those who were going to bottle feed. Those are pretty nice steps from individual clinical care to policy. Now the science is much clearer that how important good quality child care is, how destructive the pressures that a family that is living in poverty and the instabilities that brings to a family, how destructive that can be to a child's development. So now is the time for the healthcare community, pediatric and others, to step up and say those are things we need to support. What's been very interesting is in the newest ICD codes, the classification system for disease and injury, there is a code for poverty, there's a code for extreme poverty, and extreme poverty affecting the likelihood of good housing, extreme poverty affecting the likelihood of access to food, enough food. So it's starting to be recognized in the healthcare system, and I believe that the providers will start to see that there are things they can argue for. And I'll give you one mid-level example, if you will, of that. That is the increased support for home visiting for young mothers. That's something where the science has developed over the last few decades, and recently there's been growing support for that for mothers as the evidence has shown how effective that can be in helping them raise their children.
That's great. Yeah, no, you both point out there's almost a conflict between the individual pediatrician and what they can possibly do in addressing these neighborhood level issues. But one is really screening for the types of issues that you raised, Jim. And these ICD-9 codes, for those of you who aren't familiar, are the codes that doctors put in for different diagnoses. And they now have codes for things like poverty and other screening. It's like screening for lead that we do routinely, but we don't screen for poverty routinely yet. But I think.
And Doug, I've fed you a straight line there, I think, because if people don't know, the American Academy of Pediatrics has just recommended screening for poverty by pediatricians in their well child care.
Right. So I think pediatricians then play a very important role on the advocacy side, because the doctors are the ones actually seeing the families and are able to make that argument. And actually, Jack, to your point, one thing that Colby Daly here at my office said was, we already have a genome project. Why don't we have a zipnome project? Why don't we invest that same amount of money to understand neighborhoods at the same level of detail that we now understand the genetic code? I think it's an interesting question. Sometimes people feel like, oh, we can't possibly understand neighborhoods like we understand genetics. I'm like, really? No, I think we can. Really.
Just to comment on that, Doug, I mean, I think it really underscores the critical difference between our increasing ability to understand and explain how all of these factors influence health, and our ability to do something about it, right? Which is not the same as understanding it. And I think this is the challenge. And I kind of love the fact that Jim teed up this notion of a new policy statement from the American Academy of Pediatrics about pediatricians identifying poverty. Because the challenge is you can't write a prescription for a 10-day dose of eliminating poverty. And so and we also know in the healthcare system that when new treatments are discovered that show significant impact, help me on this, Jim, I think it's about a 17-year gap between the identification of a new intervention and when everybody is using it. So to me, this is the challenge for the kind of work that Nancy is doing and everyone else, is not just to understand the problem, but to really measure hard about whether what we're doing is making a difference, and not expect that the first thing we do is going to solve the problem, and learn from what's working and from what's not about how trying to change things, rather than just have a better understanding of them. I think that's our real.
That's what the science says, 17 years. And for children, that's too long, especially young children, where their life course is so affected in the first few years. And the other part we need to be clear on is that community development, whether that's housing, whether that's the provision of child care or jobs or even parks, is in effect ways of mitigating the negative consequences of poverty and the stresses for those low-income families.
Great. So Nancy, I've got a question for you. This is kind of actually getting towards this pragmatic approach that you guys are talking about. So this comes from Kristen Anderson, who's a child care planner for the City of Redwood City and the San Mateo County Child Care Planning Council. How can child care early education leaders better engage community development folks in planning for and developing financing solutions for healthy, well-designed, purpose-built facilities to house early childhood education programs?
That's a perfect layup for me. I love that question. Well, first, I think we need to sit down and get together. We need to meet. But second, I know that my organization has a team of staff that are actually consulting with local governments. They're consulting with affordable housing developers. They're consulting with transportation developers to try to make sure that early learning programs are always included in the thinking and the planning for future investment. But I think, honestly, what we really need to do is sit down together and look at where the alignment of interest occur, and then recognize what our comparative strengths and values are that we bring to the table. The Low-Income Investment Fund's particular strength is having strong, efficient capital solutions that can reach not just to our own resources, but beyond our resources into capital markets. And we're very, very good at figuring out, if it can possibly get done, how to do it. So I think there is tremendous opportunity for, if you will, a mind meld or planning together, so that we can begin sharing across our domain expertise. And I'm firmly convinced that when we do that, the